Good morning. We're gonna call the. Are we all set, Madam Administrator? Thank you. I'm gonna call the Appropriations and Human Service, Public Health and CMS regarding waiver renewals for May 19th, 2023. We're gonna call to speak Elena Trueworthy from the Office of Early Childhood Deputy Commissioner. All right. The floor is yours, ladies.
Good morning, co-chairs, ranking members, members of the Appropriations and Human Services Committee. In partnership with the Connecticut Department of Social Services and the Connecticut Office of Early Childhood, together we request that your committees approve our request pursuant to Section 17B-8 of the Connecticut General Statutes to submit the proposed Section 1915, Section B, subsection 4, Selective Provider Contracting Waiver Renewal for Early Intervention Services, also known as the Birth to 3, to the Federal Centers of Medicare and Medicaid Services. OEC is the lead agency that administers the Birth to 3 system in Connecticut pursuant to Part C of the Federal Individuals and Disabilities Education Act. DSS is Connecticut's single state Medicaid agency and administers the state's Medicaid program, including covering birth to 3 services for children who are Medicaid members. The Medicaid waiver renewal will allow OEC to continue managing the number of early intervention services programs in each community. I am pleased to be here today with Elena Trueworthy, Deputy Commissioner of the Office of Early Childhood, to assist with answering any questions you may have. I will now turn it over to Deputy Commissioner Trueworthy to provide details on the waiver renewal.
And you're Nicole, right?
I apologize. I am Deputy Commissioner Chantel Vars for the Department of Social Services.
Okay, because we were trying to, Representative Walker and I were saying, did she introduce herself?
Yeah.
We're not certain. We're a little confused. So, so you are the Deputy Commissioner.
I'm the Deputy Commissioner for the Department of Social
And
Services.
you're the Deputy Commissioner for?
Exactly. I'm Deputy Commissioner for the Office of Early Childhood. My name is Elena Trueworthy. So for over 25 years, children and families across Connecticut have really benefited from the services and supports and the comprehensive and coordinated system of Birth to 3. This waiver renewal preserves that approach. So the only real purpose of this waiver renewal is to continue enabling the Office of Early Childhood to manage the number of Birth to 3 providers in each community. And this is important for a number of reasons. So one, managing the number of early intervention service programs in each community enables our agency to properly and efficiently monitor the quality of services being provided and being able to meet the federal requirements. Also, this waiver is necessary to ensure that each Birth to 3 provider has a sufficient caseload to maintain and remain current and compliant with the many requirements for properly providing early intervention services through efficiency and providing expertise and high quality services. As a lead agency, we have a variety of roles, to meet and help meet the federal requirements. Specifically, we offer targeted training and technical assistance. We assist with dispute resolution. We provide monitoring and supervision, which can include corrective action reports, sanctions, and incentives, and also assist with fiscal management. This waiver renewal does not change Medicaid coverage or payment for birth to 3 providers. With that, we respectfully request that the Appropriations and Human Services Committee approve the request to enable DSS and OEC to submit for this selective provider contracting waiver renewal to CMS. One additional note is that we did publish notice for 30-day comment period on this waiver and did not receive any comments. Thank you very much for your partnership and your work.
Thank you. So I'm trying to figure out the very first piece of this starts talking about tribal consultation. Why would that be mentioned in this waiver? Is this a long-term something? What is that about?
Thank you for your question, Senator Austin. Let me see from my.
I am so confused. So let's
you
just go
repeat the
to the
question?
very first line, and the very first line says program overview, tribal consultation. What is this waiver doing for the 2 federally recognized tribes, and why are we not including the 3 state recognized tribes? And I have so many questions relative to this. I'm not really certain what you're doing, and I just called one of the tribal nations, and they didn't know that we were talking about them today. So I'm trying to figure this out.
Thank you for your question, Senator Austin. As I understand, communication to the tribes are typically done through email communication to let them know that we are discussing this waiver here today on their behalf.
So this waiver is on their behalf then? It is I'm trying to figure this out. It says program overview, tribal consultation, program description. Is this something that is just for the tribal nations? Is this something that is for
Right.
the state broadly? Who is this for?
Sure. I heard some of that question. So this is for the state broadly. And so this is when the OEC enters into a procurement process. This waiver allows us to limit the number of providers or programs that we have across the state. So that's important because we need to maintain the high quality services for birth to 3. And so we can do that by having a number of providers that we can work with to support and to ensure that they're meeting the federal requirements. So this is across the state.
And we're limiting the number of providers in consultation with the tribal nations?
It is my understanding.
I mean, this is not we're reading your document, the very first part 1 program overview, tribal consultation.
I'm going to ask Nicole Cassett, Director of Birth to 3 for the Office of Early Childhood, to come and provide some information here.
Good morning. I'm Nicole Cassett, the Part C coordinator, and I oversee the early intervention system in Connecticut. So what this waiver does, it is a statewide waiver for Medicaid. It is one of the most sought out waivers in the country, from my understanding, per this section. So we go through a procurement process every 5 years. Our next procurement for EI is in 2024. And where this impacts, or not really impacts, but where tribal nations come into play is due to the fact that we do support children who are part of tribal support. So we have programs that do go out and support families across the state. So we do notify them so that they are aware of this waiver being put into place, but it does not impact any family from accessing services, and it does not impact their ability to receive EI support.
So again, yeah. This is a waiver to limit the number of providers. That true? Is that right?
Yes.
Okay. Are there providers directly reflective of the two tribal nations? Are we the two federally recognized tribal nations? Can we make sure that, are we limiting them so they can't have anybody? Are we saying that they have to provide their own? Why? Representative Walker and I have been doing this for a long time. And we've never seen it detailed like this, that the two tribal nations by name are in this waiver.
This is the same waiver, so it's a renewal from 2017. And so this will operate in the same way and will be inclusive of the tribal nations from our understanding. So it will not limit the children being provided services in partnership with the tribal nations.
So this is a partnership with them, so they provide providers too?
No, meaning that we are providing services through our Birth to 3 system statewide and are inclusive of the tribal nations as well. And so children from those areas are serviced in the same way as other children and families throughout the state.
And generally speaking, federally recognized tribal nations have access to federal funds that enhance that. Is this enhance the program because of the consultation, partnership, whatever word we're using for the two tribal nations?
Yeah, that's a great question. It enhances all of the services for all children. So it does enhance those that are part of those two tribal nations, because we are able to oversee the quality and ensure evidence-based practices are upheld, all under Part C regulations, so under IDEA Part C. And that does allow us to ensure that the providers who are supporting those families are carrying out all of those practices and really providing high quality supports to all children, which does include
So I'm
the,
not questioning the high quality supports. I'm not questioning that at all. I'm still trying to get the first question answered. Have we been, we are doing something in their name. We are receiving extra dollars because they are part of this? Okay, because you just said that they would get enhanced coverage because they're involved. I'm trying to figure it out. That's all. I'm not trying to be dense, but I'm trying to figure this out.
I think potentially, we service the state across the state in all areas of the state, including the tribal nations. And so they're receiving services through our Birth to 3 system as well. The same way in which other towns and communities throughout the state do.
Okay. Are there any other questions? Representative Walker?
Thank you. You have an answer? Oh. Sure. Remember, we need an introduction. Thank you.
You gotta turn your mic.
Yep.
What
There
an-
you go.
What an intro. My name is Michael Slitt. I am a staff attorney for the Department of Social Services. And I apologize because I forgot my suit jacket today.
We all
Um,
did, so it's okay.
I'm hoping I can clarify a little bit, because I was, as you could tell, we were all a little bit confused by the tribal reference.
We did
at
notice
the
that.
beginning, and because we were, honestly, that was not, on our mind. In reviewing the application, I think there may be a little bit of confusion in that the tribal consultation is a requirement of, I believe, well, certainly this particular waiver, but generally speaking, all of the waivers that we've come before these committees in the past. What that means is it's a precursor, if you will. So part of coming here is we have an obligation to notify the tribes of this pending application. We always do that. In this particular instance, I don't believe it was any different than any other time we've come before these committees. And we don't remember ever getting this question, so I don't think we were prepared for that. I'm not a birth to three program expert, but I don't believe that there's anything specific in this request that is specific to the tribes. And that is just a part of the process that we must follow anytime we seek approval from CMS for a particular waiver. And perhaps this waiver document looks a little bit different than some of the ones that I'm familiar with. Usually that may be somewhere, in the fine print. In the other ones, it looks like this one is Section A, Part 1, the first
Right.
thing that the eye would normally see. So I guess the only, how I can best describe it is this is part of our obligations, our required notification obligations, which we believe we have complied with, but the actual substance of this request is not in any way targeted at the tribes. It's across the whole state.
So let me get, because this, I think that's what sort of threw us when the first thing we saw, we were confused as to how they worked into the mix with the things, especially when then one of the first sentences says that our goal is to limit access. And I said, okay, so there's there's a lot of things going on here that and I guess it must be a new format, because I have not ever seen the tribal notification as the very first item, which is a good thing. But it causes us to ask just a few questions about it. Is that okay?
Yeah, sure. And just to clear that there may also be some confusion with the term waiver as we've come before these committees. Usually we're seeking or we're referring to an actual waiver program.
Yeah,
The whole program itself is a waiver,
yeah.
whether it's ABI or any of the other waivers. That's a waiver program.
Mm-hmm.
Here, the departments are here seeking an actual waiver in the normal sense of the word waiver for a particular program that they're already running. It's not a waiver program that they're seeking. They're seeking to waive one provision
In the program,
in the birth to three program. And I'm sure all the staff
which is it's controlling access.
correct. So generally speaking, on a macro level, the default rule in a Medicaid program would be that if I get the right wording, any qualified and willing provider
Mhm.
would be able to provide services. There is also a mechanism for the state to file for a waiver of
Mhm.
that provision when circumstances are such that they believe it's appropriate
Mhm.
to essentially modify that rule in some way.
Mhm.
That's why they're here today, to seek a waiver that will continue to allow the status quo in their program, which has some parameters on the qualified providers and their administrative process for running their
So
program.
I guess my next question on that would be, Do we have a waiting list for birth to 3?
No, we do not.
We,
So, right, so the referrals are, go through a central point, and then they are distributed out depending upon where the referral needs and the family needs access to services. And that's on a rotating basis with the providers that we have within the system.
okay, because I mean, that's part of that was the continuous part of the confusion was to limit access. And I mean, the purpose of most of our programming is to increase access. And I could have sworn that I had heard in some testimonies that we did have a waiting list, and that we were not providing all the services for the population because funding had been shifted to other visiting children's programs. So you're sure we don't have a waiting list?
So we have some data, and I have to say that Birth to 3 is really a data-driven program and approach. And so we have certain requirements, that we need to meet from the federal government. And, as our role as a lead agency, we have to keep a good eye as to making sure that our providers are meeting those requirements and that we are as well. And so, according to the review, the percent of families receiving services within 45 days was 98.5%. And so we are meeting a very high benchmark there. And also shows families receiving services within 45 days at 99.94% as well. And so this is really a positive trend of being able to meet all the needs within the state.
Okay, I'm just going to repeat what you said so that I make sure I understand. So
Mhm.
you're saying that anybody who is seeking services in birth to 3, 98% that are still waiting, because 45 days is an awful long time to wait for service.
Right, so we have different benchmarks, right, and timing that we need to meet. So I believe it is within 48 hours of a referral being made, the family is contacted. And then a family receives an evaluation within 45 days of that referral taking place.
That, again, I think that's an awful long time for someone to get services. This is, this is starting to sound like how long it takes just to get an interview for a job in the state. It can,
Yeah,
so,
I understand those are our federal benchmarks and requirements to meet.
who established those benchmarks?
And the federal government,
The federal government
Yeah, under-
established that you must see somebody within 45 days.
right, to conduct an evaluation. Yes.
I thought that we established the benchmarks and they authorized it. I thought we presented those benchmarks. Am I wrong on that?
Yeah, Nicole's going to come and provide some
Okay.
additional detail there.
Great. Hi, Nicole.
Hello again. So
You saw only a few legislators and said, oh, this is gonna be real quick. We get over here in 5 minutes. No, no, not that work that way.
So I can absolutely explain some of this. So on average, we have children receiving services from that referral within 30 days. Our requirements under IDEA, there are 2 standard requirements that we have to report to OSEP on yearly. You can find our APR reports, the annual performance report, on our website, which outlines this in much greater detail. But one of which is that children need to have an IFSP written within 45 days of that referral.
Could you say what that is
Yes.
slowly, please?
Sorry.
So that we know what it is?
The individualized family service plan. So that is what's going to outline what the children's needs are. That is in consultation with professionals in our system and the family. The family is part of that IFSP team. A call comes in, and then within per federal requirement under IDEA regulations, the Individuals with Disabilities Education Act,
Mhm.
they have to have that IFSP written within those 45 days. From the IFSP, they must have their first service within 45 days. There's 2 separate compliance measures that we monitor our programs for.
So wait, okay, so I have to be contacted within 45 days, boom. Wait, fill out the form so that is that correct?
So you fill out a referral. So you call our central intake, fill out an online referral.
Okay.
A staff member at that central intake line
You
will
said
call you
48 hours, did you say?
within 48 hours.
Okay, I thought
Typically,
you said
it's the
45
next
days.
day.
I thought we were up to 90.
There's a lot that
Okay.
goes into the 45 days. So
Okay.
they will call the family.
Yeah.
Family will consent to the referral. We get referrals from a wealth of different areas. So pediatricians, most of the time it's families calling at the recommendation of their pediatrician, or they've used the Sparkler app and some developmental concern had come up. So they then call 211, which is our central intake line. 211 will either answer the phone, or if it's a fax referral, they will call that family within 48 hours. Typically, it's the next day. And 211 will determine if the family wants birth to 3. So the family at that point will consent to that referral. And that at that point, as Deputy Commissioner Trueworthy explained, it goes to a program on a rotating basis so that we do not inundate our providers and it's equitable across. So we identify where the family lives, say it's Hartford, a program in Hartford will be pushed that referral. Now that program will also very quickly call and schedule the initial evaluation. Typically, we're seeing about 19 days later in the data that they are scheduled, and that is due to scheduling conflicts with the family, really reaching out and finding a time that they're available and that we are not.
Okay, I think, so the pediatrician initiates the contact?
It could be anyone. So anyone can make a referral. Oftentimes we're finding that parents are calling at the recommendation of their pediatrician,
Okay,
or the pediatrician themselves call.
okay. Give me some examples of why they feel the family needs to have services under birth to 3, please.
There is flags for a significant developmental delay in motor, either fine motor or gross motor. They might have a social emotional delay, cognitive delay. We have an automatic eligibility list that's also posted on our website.
So these are
Those-
serious diagnoses
Yes.
for these children.
We do have a rigorous eligibility criteria. So children who are referred for developmental delay need to have 2 standard deviations away from typically developing children in one area of development, or 1.5 in 2, or they need to be diagnosed with a diagnosis that would result in a high likelihood of delay. So that looks like deaf and hard of hearing children, children with Down syndrome, lead poisoning would be another. There's probably about 50 diagnoses that we recognize.
But they're serious.
Yes,
Okay.
that is correct.
And the staff that goes out to see them are not limited by the reduction or managing, I'm sorry, the word of managing the number of providers. That impacts how quickly they can respond.
It does not. We watch how quickly staff are responding. So if we needed to do an RFP, so this allows us to RFP and procure the system for qualified providers.
Okay.
If we identify, and we have since COVID, we've had an increase in referrals, as we've let you all know as well in the past.
Yeah.
We are watching very closely. So we look at a 30-day timeline, which supersedes what OSEP requires. So we look, and if children are starting to be delayed in any type of way, we identify an area of need and add another program to that town. So we are monitoring this very closely
Mhm.
so that children
How
are
often have you added on providers?
We have added over the last couple of months quite a few providers to the Hartford region. We've had Hartford.
Okay.
A program was added. We had Manchester, Avon had recently come up. A lot of these are looking for providers who are designated to support children with autism.
Mhm.
All providers are equipped to support children with autism, but we do have providers that have that specialty. So families who have a child with autism might opt into one of those programs. And we've added some providers in towns that have that designation as well.
Okay, so if we had more providers, we could shorten that time frame for being able to be seen. And by some of the diagnoses that are some of the exhibiting issues, those are things that could be very damaging to a child growing. So it would probably be worthwhile to think about how many providers we have so that we can address it. I do know that this line item has been reduced in quite a few instances. And one of the reasons I was told was because we had another visiting program called Child First, I think. Is that true?
Right. Child First is a home visiting program, not a birth to three provider.
No, but it's another program that's similar to Birth to Three, isn't it?
I would not consider it necessarily similar. Birth to Three has a really specialized approach when it comes to children with delays and
Okay.
disabilities.
And Child First doesn't?
Child First is more of a home visiting, from my understanding, approach that really looks holistically at the child and the family and
But I thought Birth to
social
Three.
emotional
That, yeah,
approach. And so I would assume that Child First working with the family, if they were to see a child that is displaying some delays or some red flags, for example, then they would work in partnership and to refer that family to Birth to Three. Birth to Three has the specialization and the training and the skills specifically related
So
to
they,
delays.
so Child First can refer children to Birth to
Absolutely.
Three.
Yep.
Okay, but their budget has increased over the last year or two, yeah?
Okay. I'm not sure.
Yes, it has.
Okay.
Okay, so okay, all right. Thank you, Madam Chair.
Thank you. And Senator Seminara will be speaking next, but give me 1 second, Senator. So I did contact one of the 2 tribal nations and said that they don't see any problem with the waiver and that the statement appears to be perfunctory and prospective, but they would welcome a better just establishing a better relationship and communication process to just send an email out to an email that we don't know if that email even exists any longer is probably not the wisest thing to do. And we would really like to make sure that when we're bringing up sovereign nations, that they're actually getting their voice heard. And I'm not certain that that's what happened in this particular case. So I'll contact the other tribal nation as we move forward, but of the 2 federally recognized tribes, but I would like to understand too what we're doing with the 3 state recognized tribes. To make sure that we're contacting them if we're going to contact the federally recognized tribes. Senator?
Thank you, Madam Chair. So if I heard you correctly, by the way, I should start by saying that many years ago, my daughter received your services and they were always very good and I commend the work that you do. So I'll just start with that. But if I heard you correctly, there are times that you are exceeding the federal levels of of the 45-day requirement, correct?
So we are lower often. So we are, yes, that is correct. Typically, it's about 30 days.
Great. So I guess my question would be, why do we need to renew this waiver if you're saying there's no waiting list? And that we typically, I know that you are exceeding the expectation, but if we didn't renew this waiver, would that enhance your capability of providing services even sooner?
So it's my understanding that under Medicaid, and I'm sure they might be able to answer this much more appropriately, but we need to be able to procure the system for folks who have a contract with the Office of Early Childhood so that we can monitor these evidence-based practices and be sure that others in that area couldn't just say we are an early intervention provider and then bill Medicaid for early intervention. It allows us to only have our contracted providers be able to associate themselves with early intervention. And if that were not to happen, then we would have a wealth of programs that it would become unmanageable to monitor the quality supports. And it would also become unmanageable to align ourselves with the regulations and monitoring that IDEA requires us to do.
Okay, so if you mentioned earlier that you also have seen an increase in a number of providers in different areas, Hartford, Avon, so on and so forth. Do you feel, is there a dearth of providers anywhere?
Every town has at least 2 programs in that town for family choice. So we also take into account that families do need choices in the provider that they are seeking. We do operate under a due process. So if families ever have a complaint or they are not receiving services in a timely manner in their opinion, or we're seeing that in the data, we will reach out to that area. We have not, for timelines in terms of across the state, we have not seen any area be particularly delayed in any way in terms of going beyond that 30, 45-day timelines. We have seen areas of the state where we struggle with providers. We know the Northwest corner has historically been an area where it's really hard and challenging to find a PT to work in their program. So we're doing a really great job at creating partnerships with institutes of higher education. I have staff in our PD department that really are reaching out, trying to create these partnerships so that we can help recruit qualified interventionists. We also put out for student placements. So our providers were able to have student placements for observations and also for CFY, clinical internships, what have you, so that we could recruit and retain. But in terms of the number of providers, we're not seeing any sort of desert, if you will. But we are seeing that sometimes discipline specific, we are seeing some challenges. In those instances, if a child needs PT and that program does not have a PT, they are welcome to contract with PTs. They are able to do that at the local level. They are also able to call their colleagues. And oftentimes we do have a request that the family really needs to be transferred to the other program in that town, because the program that received the referral, they might have a shortage in an area. So their colleagues help them and we just transfer the child. It's still the same. They're receiving early intervention. They are still up to the rigorous standards that we hold them to, but it allows us to have flexibility in that way.
Okay, I'm very glad to hear that, because I do represent the Northwest corner and I do recognize that there's a dearth of services from time to time, depending on the discipline that we're looking for to provide services. So if I'm hearing you correctly, then you are partnering with other providers who are providing similar services, correct?
They would bring those individuals on per diem or onto their staff. So they, our providers would work with them. But yes, we would not say that we don't have this service and we cannot provide you. We will do our due diligence and make sure that that child receives everything that they need in partnership with the IFSP team and also the family who is part of that IFSP team.
Okay, thank you. Thank you very much for answering my questions.
My pleasure.
All right, thank you. Representative Nolan.
Good morning, and thank you, Madam Chair. And I just wanted to follow up on some of the things that Representative Walker talked about, especially the time in which the 45 days. And I just did hear you say that sometimes it's as little as 30 days. Could you let us know how often it stays around 30 days and how often it goes up to 45 days or more?
That is our average. So any given day, when we pull the data and look at it, it is about 30 days that children are receiving services within that time frame. It's not very often that it goes beyond that, because we are watching and adding programs as needed to those towns if we're seeing any sort of delay in the receipt of services.
And what would you need to make it less than 30 days?
The challenging part with the 30-day timeline is there's a lot that goes into that for service coordination and really pulling people together so that, and that includes the family. So scheduling, and this is going through that timeline is to that IFSP written. So it includes an evaluation, it includes the outreach materials. Sometimes we call the family and they don't answer the first day and they call us back 3 days later. So I don't know that there's anything we could do to shrink that timeline, just given the amount of effort going into that, and that is going to services. So that, again, that includes the evaluation, that includes reaching out to the families.
And you, if I'm not mistaken, you said there's not a waiting list, but you said in certain areas you provided certain other providers or staff. Could you just break that down a little bit and explain how you did that and what triggered the need for that?
Sure. So if I hear you correctly, the question is, how did we determine we needed to add another program to certain towns? So what we do is we regularly monitor our data system, and we run a data report that looks at referral to IFSP very consistently. On our website, we post these timelines as well. So it's there for public knowledge if you are ever interested in taking a look. If we heard families calling us and saying, hey, I haven't heard from my program, which sometimes happens, they will call us. Typically, families call because they don't know to call the contracted provider. They just hear Birth to Three and they search Birth to Three and find our office's number. But what we do is we look at that timeline data. So we look at referral to IFSP. And if that is lagging in any sort of way, we have a conversation with the providers. Sometimes our providers have called us and asked us to add a program because they are becoming overburdened and they want to prevent that delay of families and the receipt of services. So they will call us and say, we are all in agreement. All of the providers in this town are in agreement. We need another provider. And then we reach out to providers that are close to that area and that could take on additional referrals.
Are you all set, Representative? You're muted.
I'm sorry, if you were to say you had to, that you added providers, how many extra providers would you say you added throughout the state in the last year?
So when I reference adding providers, we're not adding to the system as a whole, we're adding to that specific town. We have not yet had to do an RFP of need, but we're watching that closely. So if we saw that statewide, we would absolutely go out to bid for more contracts. However, our current contracted providers have been able to handle the increase in referrals, and they have contracts with us to serve certain geographic areas. And when we see that geographic area starting to lag, we then contact the contracted providers in that area and add a program to that town. We have not had the need to go out to RFP at this point.
Okay, thank you, Madam Chair, and thank you for coming before us today.
Representative Santiago.
Thank you, Madam Chair. I just want to clarify a couple of things, and then I have one question. This Birth to Three program is under the IDEA Federal Act, which is Individuals with Disabilities Education Act, which is the law that makes available free, appropriate public education to eligible children with disabilities throughout the nation and ensures that special education related services to those children. So with infant and toddlers through birth through age 2 with disabilities and their families receive early intervention services under IDEA Part C. And then from 3 through 21, they usually receive special education related services under IDEA Part B. So of course, as you know, that's also under the ADA, American Disabilities Act. And there is a 45-day mandate by the federal government that once they hear from a parent that there is a disability with their child, whatever the disability might be, it could be a hearing loss, it could be Down syndrome, it could be autism, anything. The Birth to Three program, but not only them, the Board of Ed program in that specific town has to respond to that concern from the parent. If they do not respond within the 45 days, that parent can sue that Board of Ed or the program, mostly the Board of Ed. That's where most of the concerns also come through. If the pediatrician makes the referral and people call 211, but there is also another way to get a referral through, which is the local Board of Ed. And parents can reach the Board of Ed administration and file in writing a need for their child to get those services from birth to 3. And a lot of those referrals are not just from providers, but they're also from, example, Head Start programs, who will see in their infant and toddler program that there is a disability or there is something different about the child that's not right, and they want to get the child tested. And it also comes through preschool programs. So it's not just pediatricians, but it's also programs that infant and toddlers, as you know, with women going back to work, they might notice that there is a need for a checkup or a test to be done with this infant or toddler. And I know that because I went that through my son. So, you know, it is a great program, and we need to keep funding this program, because the earlier that we get a have a service or disability through the IEP, then the sooner the child can receive the services they need. But my question to Ms. Trueworthy is, is DSS the only agency that receives the funding through for the Birth to 3 program? Because I heard other agencies also get it.
DSS is the Medicaid agency, and the Office of Early Childhood receives state funding and federal funding to operate the Birth to 3 program. And I just want to thank you for raising up. The partnerships are absolutely vital, especially with families with young children in the early years, right? And so we work as a system in which we accept referrals from all different places, and we respect the expertise of parents and identifying that their child might potentially be delayed. And we also saw throughout the pandemic, when children were not being seen by some of these regular providers or childcare providers or whatnot, that the referrals dipped. And so now that we're back up, right, and children are being seen, it is wonderful that they are being referred and they are being supported. And early on, like you said, is absolutely vital to ensure that those services and supports are brought to the family and to the child early on.
So I'm just bringing the issue up of who gets the funding between DSS and OEC. So do you know, and I don't know if you can answer this question, if OEC is included in the funding, are they also making sure that these Birth to 3 programs are being funded? Because we did have a fair the other day at the Capitol, and one of the Birth to 3 programs that was there is concerned that they are not, that the increased funding is not going down to them from OEC. So now that I know that the funding is also through DSS, I think we need to have more conversations to make sure that if they're getting funding under the DSS or OEC, the Office of Early Childhood, that these programs that are vital to detecting needs of babies is being funded correctly. And I think that and I did talk to this Birth to 3 program that we need to probably have a meeting after session to really find out what's going on with all this funding. Because to me, these programs really need to get funded properly. And that's it, Madam Chair. Thank you. And thank you, Mr. Worthy, for being here.
Thank you. Up next is Representative Dathan.
Thank you so much, Madam Chair, and thank you for your presentation today. It's been really useful. I have a few questions. The first question has to do with data for children that matriculate out of the Birth to 3 programs. What does the agency do in terms of keeping track of children that are 4, 5, 6, and then going into grade school, to see the effectiveness of these Birth to 3 programs in their educational life cycle?
That is a great question. Thank you. So we have strict timelines for transitioning out of early intervention, and we partner with local education agencies. So we have great relationships. Our providers, I shouldn't say we, our contracted providers have really great relationships with the school systems in their towns. So they work on that handoff, ensure a smooth transition to those for those who are eligible for Part B, which is preschool special education and beyond. And so that we work with SDE from a state level on outcomes and looking at trends to be sure that children who have received birth to 3 and then move into preschool special education are receiving supports. We have had collaborations on training materials in the past, and we've done transition roadshows. That's what we've called them, to really explain this process and looking at the benefit. Where we really get a lot of really great data from is our family outcomes, so that our focus in birth to 3 is that we are supporting the family to support their child, and we have child outcomes. So we are absolutely supporting the child, but it's a family unit. And our state identified measurable result is that families are able to better advocate for their child, explain their child's needs, et cetera. And that carries them through the lifespan. So that is the outcome that we're looking for in terms of Part B preschool special education, so that the family can then go and advocate for their child at the school district level. We also contract with CPAC, Connecticut Parent Advocacy Center, and we are looking to ensuring that all families have someone at CPAC that they can call and really partner with them so that they can carry out throughout. So once the child leaves birth to 3, that CPAC is there if the family ever needs help. But we are seeing really great outcomes upon exit, and we do track those outcomes from entry to exit of the Part C program.
That's wonderful news. If you can share with the administrator kind of a sample on how that data looks, so that we can kind of just get an idea of what you're looking at. But it really sounds great. My second question has to do with looking at level of
Representative
needs.
Dason,
Yes.
if I could just find out how many questions you have, the next commissioner has to go.
Yes, I just have one more.
Okay.
I thought we were limited to 2, so. Is that
Go
okay?
ahead.
Okay, great. My second question is looking at these birth to 3 programs in terms of assessing children's level of need and IQ testing. Just wanted to know if these programs, when assessing these children, is that part of the process of these programs?
So birth to 3 utilizes evaluations such as the Battelle inventory, the BDI, the Battelle developmental inventory, my apologies. Or if there are assessments that we can use, such as the HELP or the ADOS to look at autism diagnoses. We are not necessarily doing IQ testing, but we are doing evaluations that are evidence-based and procured through that process, so that we are sure that we are able to track outcomes and see the developmental needs of the child.
That's great news. If you can share some of that, how you manage that with the administrator. So I'm just thinking about this in light of 5001 and how we are making sure that children don't fall through the cracks that need services. So thank you so much. And again, thank you, Madam Administrator, for the indulgence.
Thank you. Are there any other comments or questions? Seeing none, you're all set, ladies. Commissioner Chef, you're up.
Good morning. My name is Chantel Vars. I am the Deputy Commissioner for the Department of Social Services. We are here, ranking members, honorable members, Senator Austin, Representative Walker, Human Services Committee members, Thank you for having us here today. I am here to support the Department of Developmental Service Comprehensive Supports Medicaid waiver in accordance with provision 17B-8 of the Connecticut General Statutes. I am pleased to be here with Jordan A. Sheff, Commissioner of the Department of Developmental Services, and other members of DSS and DDS team to assist with answering questions you may have. I will now turn it over to Commissioner Sheff to provide details on the waiver renewal before you today. Thank you.
Good morning, Jordan Sheff, Commissioner at the Department of Developmental Services. A pleasure to be here with you this morning. What we have before you today is a pretty straightforward renewal. You have my written testimony. There's no changes other than technical provisions that wouldn't change the way we administer or currently provide services. And so with that, and given the time, I'll gladly turn it over to questions and go from there.
Good morning, both of you. Commissioner Sheff, in perusing this is the HCBS waiver that you're talking about?
This is our HCBS comprehensive waiver. As a reminder, we operate 3 separate waivers. This is the bulk of our service, bulk of our expenditures for comprehensive services like group homes and other more comprehensive services like that, as opposed to our day and supports waiver or in-home supports waiver.
Are all your group homes part of a unionized workforce?
No.
About how many are unionized and how many are not?
I can provide a more detailed number than that as this pertains to the upcoming strike. There are 205 group homes that will be going out as of today. On strike, we operate 850 group homes and another 400 or so, 450 3-person settings that aren't group homes. The providers that are unionized represent, I think, 40% of those homes. But
40% of all
of our total capacity. But I
your
want to
total
vet that number with our data folks and confirm that through Ms. Keen, if that's okay.
Sure, but I just want to make sure I have the facts right.
Yep.
So you have 205 that are going out on strike right now.
Yes, ma'am.
You have, and those are unionized.
Correct. The only the
You have
unionized.
850 group homes in total, give or take, 1 or 2. And you have 453
450 3-person homes that are not technically group homes, but are subject that providers operate that may or may not be unionized.
And so you have a total of 1,300 environments, give or take.
Yeah, that excludes anybody who's living in an apartment or in a community companion home or some of the other settings. But in terms of our comprehensive settings, 24/7 settings, that is correct.
And you're saying 40% of the 1,300, give or take, are
That is
unionized?
that's my guesstimate for you today.
All right, and I'm perusing through your HCBS waiver. Do you consult with the 2 federally recognized tribal nations also?
So it has been our practice along with DSS to notify the tribal nations by email. I heard prior questioning and we'll work with DSS to see how we might notify them in future renewals or amendments, perhaps taking a different approach. It's been our longstanding practice, though, simply to issue an email. I can confirm that at least one of the leaders from the tribal nations is in receipt of that notification. We confirmed that before coming in the room this morning.
Because we were asking questions out there?
That is correct.
We got to stop asking questions out loud, Tony. And so I'm looking at the waiver. I don't see it in consultation with the 2 tribal nations, but it is your practice.
It's in a section. You have a specific section, Krista? If you want, I can read it. You just
Thank you.
highlight it for me. Section 4 of what subsection?
Section J of the appendix.
So Section J of Appendix I, the state assures that it has notified in writing all federally recognized tribal governments that maintain a primary office and/or majority population within the state of the state's intent to submit a Medicaid waiver request or renewal request to CMS at least 60 days before the anticipated submission date is provided by Presidential Executive Order 13175 as of November 6, 2000. Evidence of the applicable notice is available through the Medicaid agency. That's the provision within the waiver, page 7 of 294.
Thank you. All right, are there any other questions for the commissioner? No, I don't see any other questions, sir.
Well, I
Can you
have
get
plenty
us
to do
that-
back at the shop, so I appreciate, and I appreciate OEC taking a lot of those questions. We were ready to answer them quite
You-
promptly,
can
so
you
I'm.
do two things for us. Can you make sure that we are appraised of the exact number of homes that are going out on strike and where they are? The exact number of group homes that you have, the exact number of the 3-person environments that are not necessarily considered group homes, and how many of them are are within the confines of a collective bargaining environment.
We-
And the settlement of those contracts, would that result in an increase in funds necessary for the 2 chairs of appropriations to increase the dollars relative to that?
With regards to the first portion of your request, we have an incident command set up that is gathering and has. And
Wait a
I'm
minute.
okay with that, Ms. King.
There you go. Go ahead.
You almost made that easy for me.
No, I was not. We will not.
We will provide the data. Our incident command is gathering that, and well, our new emergency management person came from DESP and has some great skills at organizing that data and mapping it. So we can give you some pretty good detail on that, including the breakdown on unionized versus non-unionized. It isn't within my purview to determine the negotiations or what, how that would work. I think to answer your question just broadly, it would appear to me that 1199 is seeking more money through an increased COLA beyond the 1% that's been articulated currently in the budget as proposed by the legislature and the governor.
Yeah, I don't think the governor put anything in the budget, but that would be my understanding as looking at his. So yes, the legislature put 1% in above and beyond what the governor put in. All right, any other questions? No. Thank you very much.
Thank
Appreciate
you.
it. Up next is Deputy Commissioner, do you have anything else from DSS?
We do not. Thank you. Have a
Thank-
good afternoon.
Thank you. Is there any other comments or questions? Okay, we're on to the public. Is Max Perkins here? Max Perkins? Why?
Hello, Chair. I am here.
Okay, very good. The floor is yours. You have 3 minutes, sir.
Thank you. Good morning, Senator Austin, Representative Walker, Senator Lesser, Representative Gilchrist, and members of the Appropriations and Human Services Committees. Thank you for the opportunity to testify before you today on the Medicaid waiver renewal applications. My name is Max Perkins, and I'm the Senior Policy Manager for the Northeast for Unite Us. Founded in 2013 by 2 veterans, Unite Us builds coordinated care networks to securely connect health and social care providers in a common ecosystem, enabling bi-directional referrals and communication between once siloed providers. The Unitas model of care coordination supports the delivery of whole person care, enabling providers to coordinate the resolution of all unmet needs of the patient, from nutrition support to transportation and in-home services. In Connecticut, Unitas manages the Unite Connecticut network, which is supported by partner organizations such as Yale New Haven Health, Community Health Network of Connecticut, community health centers, and many other wonderful institutions across the state. After 10 years working to connect our fragmented systems of care, we know our networks increase access to health and social services and are driving improvements in overall health and well-being. I'd like to share a brief example of our work supporting a first 1,000 days project in Florida, which will highlight the opportunity before Medicaid and the benefit of integrating coordinated health and social care into the Medicaid delivery system. We're proud to partner with the First 1000 Days Sarasota program, a program sponsored by Sarasota County, Florida, which connects families with community resources, such as financial assistance, healthcare, and food during pregnancy and in the first 1000 days of life. Preliminary findings from a retrospective matched case control study looking into the impact of Unite Us adoption on postpartum healthcare utilization for patients at one of the partner hospitals in the program show that patients that were referred for services through Unite Us experienced a statistically significant reduction in all-cause hospital postpartum admission. Specifically, patients referred to services through Unite Us showed an approximate 61% reduction in odds of all-cause admission at 3 months, 44% reduction in all-cause admission at 6 months, and 42% reduction in all-cause admission at 12 months, in each case compared to matched controls. In addition, patients referred to services through Unite Us also showed large reductions in postpartum-related hospital admission at 3, 6, and 9 months. An important finding also suggests a large benefit for Medicaid itself. When stratified by insurance type, preliminary findings showed that patients covered by Medicaid saw a 77% reduction in odds for postpartum related 30-day readmissions. We think the opportunity is clear. When effectively integrated into delivery systems, coordinated health and social care can provide a large benefit to residents in Connecticut, the state of Connecticut, and the Medicaid program. The committee should consider working with DSS and other departmental stakeholders to ensure there is sufficient policy and financing within the waivers to support these strategies. Thank you for the opportunity to testify.
Thank you. Are there any comments or questions? Seeing none. Thank you, sir. Up next is Evilise Correa. Evilise, floor is yours. 3 minutes.
Had a feeling of it.
I know, I figured that out. Okay, don't forget to turn on your mic and identify yourself. Don't worry, keep going.
Did you find your phone?
Yes, we already have our phone.
Okay, I don't know who's buzzing their phone. Okay, thank you very much for allowing me to speak today. My name is Evilise Correa. First of all, I would like to begin by stating my support for the waivers as the mother of an autistic 12-year-old who went to birth to 3. Any sort of limitations on programs or anything else like that, whatever slows down the process is detrimental to families. Even now, my friends, I sometimes walk them through the process, which is, calling 211, waiting for the services and everything else. Depending on where you live in the state, though, depends on how fast they respond and the services your children receive. Hartford Public School students who graduate from Birth to 3 program afterwards will find themselves on an 18-month waiting list through Husky pre-pandemic for ABA services. So as soon as they drop out of Birth to 3, they will be severely underserviced, and we do not have enough teachers in Hartford to implement IEPs. We barely have enough teachers to write them. So that's something to keep in mind when we're talking about these waivers. When children age out, they will be severely underserviced. Also, this one caught me by surprise. I didn't see it on till this morning, the paper. HB 6760, I did read through the bill. I graduated early from high school and half a credit over in civics. The extra half a credit came from teachers who could not accommodate my needs despite their best efforts. So I ended up doing independent study, and that work ended up being published in Dodd Center for Humanities. I would have killed to have access to the curriculum that's being proposed, and did want to support that. And after reading the bill from the committee, I also hope that Appropriations does properly fund this curriculum and does look at our worst performing districts. Even if you do see tons of money coming into Hartford, you need to see what goes out to magnet schools, and that's at a higher cost to us. So anytime we talk about waivers, anytime we talk about special education, there are children being left behind, and someone does need to track those funds. So leftover children in these districts are disproportionately special education. And those are disproportionately children who did go through birth to 3 and will go through the cracks. I do yield my time, and I'm happy to answer any questions, both as a mother of a child in special ed, a child who's in the gifted program over in Windsor. And I got 4 kids. One of them's in college, so.
Representative Dathan, I see you have a question.
Yes, thank you, Madam Chair, and thank you for your testimony and raising the light on some of the issues that you've experienced as a parent. And you've done it sounds like a fabulous job navigating the system. This is something that we are very much focused in on as part of the 5001 bill. And we are hoping that we can get a good pathway for parents to be able to navigate the systems easier and get their children into services. And like you've highlighted, making sure that kids don't fall through the cracks, to get these services early. So we all know that early intervention is key. So I just wanted to say thank you. And I do hope we can keep in touch, because I would like to make sure that things that we're implementing in 5001 are actually working on the ground and really helping parents. So thank you for your advocacy. Thank you, Madam Chair.
Thank you for the comment. Representative Walker.
Thank you. And first of all, thank you for again, for coming up and testifying. I saw sometimes there was a raise the roof response to some of the questions that we were asking. One of them in particular was the one about the wait list.
Yeah.
Did you, when you were going through the process, did you have a long wait?
So I was blessed with my first son. I was not able to, this is 2008, 2009, so I wasn't able to get it. I was living on Broad Street in Hartford at the time. Then a couple years later, I have a second son, 2011, and there was something wrong with him, but I was living in Windsor at the time, much more accessible. So I'm not sure if it depends on the zip code or whatever it is, but getting services in suburban areas was much easier.
Really?
Yeah.
Interesting. Interesting. So
I'm willing to sign releases if you guys want to look through stuff.
no, thank you. We probably would like to, I hope we have your contact information. Because I think there's some help in being able to find out what were the highs and the lows. I'm sure there were both, because you said that your child got services.
Yes, my 15-year-old now, he's in a more advanced curriculum. Unfortunately, there's been a couple times where he was so far ahead of the class that they had to put him they just put him in a Chromebook in the back of the classroom. Thankfully now he's in high school, you're able to shift and move classes around, so he's an AP. But with my other son, he's going to need services most of his life. And it was frustrating. So I found the best way to access services was actually, despite qualifying for Husky, paying about 1/3 of my paycheck in private insurance. There was no wait list in ABA. There's been no wait list in any services. So when I was on Husky, the wait list to get ABA services for my special needs son was 18 months. You would then get 9 weeks of services, and then you go back on the wait list. So this isn't birth to 3, it's ABA, but they, these things do work in tandem and everything else. So I'm not sure what that is now, but this was pre-pandemic numbers I'm talking about.
Well, it would be our honor to have you stay in touch with us so that we could actually go through. And if you have other parents that are going through any of these experiences, it would be helpful, because that's who we need to.
Yeah,
address.
most parents who are on Husky are probably working right now.
We can wait. We can do it evenings. We can do Zoom.
Yeah,
we'll figure it
So
out.
that would be awesome, because there's so many parents that don't have the support to get here. They're working, they have to pick up their kids. Their kids just can't take the city bus over to the Capitol. So many times there's I know commissioners and, people who are appointed are doing their best, but they can't always answer questions like, people who do have the boots on the ground, parents, the people providing the services. So many times I feel for them, but they just don't have the answers. And there's a breakdown in communication.
Okay. Thank you. Thank you for your advocacy.
Thank you.
Don't stop your advocacy and help those people around you so that they can get the services too. So thank you very much. Have a good day. Thanks.
Thank you.
Are there any other comments or questions? Representative Porter?
Thank you, Madam Chair. And I don't have any questions. Evelise, I just wanted to thank you and join in that chorus. You do a lot of advocacy in that building. You stand up unapologetic, and the way that you bring things to our attention and highlight the things that really need to be bridged in this gap is appreciated. And I just wanted to take a moment to say thank you. I really do appreciate not just your passion, but your commitment and your dedication. Thank you, Madam Chair.
Thank you, Representative Porter. That's a big deal coming from you. You have no idea how much of a fan I am of yours.
Representative Santiago?
Thank you, Madam Chair. Thank you, Evelise, for being here today. 40 years ago, when my son, and he's still disabled, has a disability, Spanish interpreters and Spanish translators were difficult to even get back then. So I used to advocate a lot with disabilities, parents that didn't speak English, I'm sorry, that didn't speak English. And I had to go as a parent advocate, go to the PPTs with them in order to make sure that their kids were getting services and explain the federal regulations according to them getting services. My question is, do you find out that that's still a problem today in your experience?
To be honest, I haven't seen it when it comes to education. I've seen it recently at DMV. But that was a whole nother issue. Because Spanish is no longer my first language, it became English as I grew older. Most of my friends speak English, so I wouldn't be able to answer that question honestly. But what I could tell you is that I've seen the language barrier become a huge problem at DMV and other places. So if other government agencies are going through it, I would guess that they're still going through that, but I wouldn't be able to say with 100% certainty. But when you mentioned translation, it's always a problem. So I'm always going to the doctor with my grandmother. I'm always going to the doctor with somebody. So yeah.
Okay, so I know that I'm pretty sure it's still a problem. Because
I would imagine.
Yeah, because I still get phone calls from my constituencies when they make phone calls, especially through other services. And it's even difficult to find providers that are bilingual that will be able to talk to these parents unless you go to the community health centers, because they usually make sure that there are bilingual staff there and bilingual providers. So I believe that it's still a problem, not only in fighting providers that can work with these parents that don't speak English, but also in making sure that the information is translated. So, well, thank you for your honesty and keep fighting the good fight. Thanks.
Thank you.
Thank you, Madam Chair.
Thank you. Any other comments or questions?
Oh, she's my mom's rep, by the way. So Ms. Santiago.
Representative Paris?
Thank you. I just wanted to get clarity on, gain clarity on how long the wait time has been on those lists, either for yourself or for anyone that you know. What's the average length that you've heard or the longest length that you've heard? Thank you.
That's a good question. To be honest with you, it's never really accurate. They'll tell you 6 weeks, it's been 4, it's been 8. So it's kind of hard to gauge, depending on where you live, depends really on response times sometimes. I don't know if they're saying that they're calling people within 48 hours and 45 days. I don't know. No one ever got a hold of me back in 2008, 2009. But I received services quickly in 2011, 2012. So for birth to 3, I can't really answer that question. For ABA services, which happen to be really common, most of the time, parents opt not even to get out of home services and instead just go through the school, which is about 30 minutes a week. I got really, really lucky, and a new program had just opened. I found this woman through Facebook, and my son's still receiving services now, and he's been receiving services since 2018. But I mean, when I was speaking to Beacon Health Options was completely full. And I mean, they keep getting piled on with more stuff, and there's more things that keep getting subcontracted out. So they were already at capacity pre-pandemic, and now they're just exploding. And so I don't know how much more the state's going to put on them, but they can't bear the weight of anything else. Trust me. Yeah, so I'm sorry, I don't have an exact number for you, but the wait time's going to suck.
Thank you. Thank you for that. Appreciate it.
Any other comments or questions? Seeing Representative Exum.
I know we're ready to wrap up. I just wanted to thank you for coming out today and giving an array, a glimpse into what it's like as you're experiencing it. But one thing I just wanted to highlight is that you bring to mind, as we spoke earlier about wait lists, I think it really is important to understand that there are different types of wait lists, and the ABA one will be different than the birth to 3 one. And it does make me want to find out more later as a follow-up about what the ABA list looks like and what the utilization is like, how long those wait times are. I think that's really important, because more than anything, having early intervention is a game changer for so many of these young children and families. And it's really important that we stress that, so we understand the longer they're waiting, it does impact the outcomes. And there's a lot of weight on the school systems. They do a great job, but we also need those services. And so to really get an understanding of the ABA piece, which is applied behavioral analysis for usually individuals on the autism spectrum, I think that's really important to add to this discussion as well. So thank you for bringing that up. Thank you so much, Madam Chair.
Thank you.
Any other comments or questions? Seeing none, you're all set.
Right.
We're gonna
Thank you very much.
We're going to close the public hearing now and call the committee meeting to order. And are the chairs of Human Services?
We are.
So up to you.
Oh, I will be calling to order then the May 19th, 2023 meeting of the Human Services Committee. I'll turn it over to Representative Gilchrist for any opening comments.
No opening comments, just
Okay.
glad to be here.
Our rankings on Senator Seminara.
Yes, good morning. I'm here, and thank you very much for the acknowledgement, and happy to be here and happy to hear the testimony this morning. Thank you so much.
Thank you, Senator. Representative Case.
No, we're good. Let's vote, and hopefully we can find out more on waiting lists.
Okay, terrific. Moving on to item 1 on the agenda. I'll entertain a motion to approve item number 1, OEC birth to 3 waiver. Is there a motion?
So moved.
So moved.
Motion by Representative Gilchrist, second by Representative Dathan. Is there discussion? Seeing no discussion, the clerk will please call the roll.
Representative Gilchrist,
Yes.
Senator Lesser,
Yes.
Senator Seminara,
Yes.
Representative Case,
Your Representative Case votes yes.
Senator Gaston, Representative Dathan,
Representative Dathan votes yes.
Senator Marr,
Senator Marr votes yes.
Representative Butler, Representative Cook,
Representative Cook votes yes.
Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes, but I don't know why my picture is blanked out. I don't know why.
we'll come back to you.
Yeah, I don't know. I don't know what this is. I really don't understand why why it's not showing. There's no, I don't know what to do about it. So this is something new.
Madam Chair, I can tell her if you want me to.
Yeah.
Susan, there is a button at the top of your, above your keys, your numbers and stuff. It should have a camera on it with a slash going through it. You might have hit that instead of your power button.
Oh, thanks so much. I'll work on that. Thank you so much. Appreciate it.
You're welcome. Thank you, Madam Chair.
I love it. Go ahead.
Representative Johnson. We'll move on. Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Representative Buckby votes yes.
Representative Ferraro, Representative Mastro Francesco, Representative Pizzuto,
Representative Pizzuto votes yes.
Representative Paletta, Representative Johnson, are you back on? Or any other members of the Human Services Committee would like to?
Sorry about that. I'm still looking for the spot where I'm supposed to be. So
Okay, Madam Clerk, maybe what we'll do is we'll wait just a couple of moments to announce a tally. We'll do the other one, and then we'll come back for folks who are having technical difficulties. Is that, I think that's okay.
Did it.
I'd like to have a motion to approve the DDS comprehensive supports waiver. Is there a motion?
So
So
moved.
move, Representative Dathan.
Motion by Representative Dathan. Is there a second?
Second by Seminara.
Second by Senator Seminara. Is there discussion? Seeing no discussion, the clerk will please call the roll.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Lesser,
Lesser, yes.
Senator Seminara,
Senator Seminara, yes.
Representative Case,
Representative Case votes yes.
Senator Gaston, Representative Dathan,
Representative Dathan votes yes.
Senator Marr.
Senator Marr votes yes.
One more time for me, please.
Senator Marr votes yes.
Thank you. Representative Butler, Representative Cook,
Representative Cook votes yes.
Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
your camera's still not on.
Well, it says it's on over here. I'll try a different piece of equipment. Thanks. Bye.
Oh, thank you. Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago, Representative Buckby,
Representative Buckby votes yes.
Representative Ferraro, Representative Mastro Francesco, Representative Pizzuto,
Representative Pizzuto votes yes.
Representative Paletta. Are there any other members of the Human Services Committee that has not cast their vote that would like to do so? Thank you.
Okay, Madam Clerk, if you could please announce the tally. Before we can see, there's a member who just got on. I don't know if it's too late to. Representative Johnson, I think you might have just made it under the wire.
Can you hear me okay?
Yes, I can hear you and see you. So item
good.
number 1, the OEC birth to 3 waiver renewal. How do you vote?
Yes.
Thank you. And then item number 2, the DDS comprehensive supports waiver renewal.
Yes.
Thank you.
Thank you. Sorry about that. I don't know what happened here. I can't seem to figure it out. My phone's okay though. Thanks a lot. Appreciate it.
Madam Clerk, would you please announce the tally on item number 2 and then on item number 1?
The vote tally for item number 2 on the agenda, total voting 21, 15 yays, 0 nays, 0 abstain, and 0 absent, or sorry, 6 absent and not voting.
Motion passes. That's on item number 1, you said?
No, you asked for item number 2 first.
Okay. So item number 2 passes on item number 1.
Item number 1, total voting 21, the yays are 16, nays are 0, abstain 0, absent and not voting 5. Thank you.
Okay, the motion passes. At this point, I'd like to recess the meeting of the Human Services Committee. Turn it back to Appropriations.
So we're going to go on to appropriations. I'm going to convene the Appropriations Committee meeting. And I will ask for a motion in a second to approve the 2 waivers together. Item number 1 is the 3 waiver renewal. Item number 2 is the DDS comprehensive supports waiver renewal. We're working both of them together.
So moved, Madam Chair.
Senator
Senator Berthel.
Moved by Senator Berthel, seconded by Representative Dillon. Is there discussion? Seeing no discussion, Madam Administrator, if you could call the roll, please.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker. Representative Walker votes in the affirmative. Senator Hartley. Representative Exum.
Representative Exum votes yes.
Representative Paris.
Paris votes yes.
Senator Berthel.
Good morning, Madam Administrator. Senator Berthel votes yes.
Thank you, sir. Good morning. Representative Nuccio.
Representative Nuccio votes yes.
Senator Anwar. Representative Baker.
Representative Baker votes yes.
Representative Valinsky. Representative Callahan.
Representative Callahan votes yes.
Representative Candelaria.
Representative Candelaria votes yes.
Representative Chaleski.
Representative Chaleski votes yes.
Representative Curry.
Representative Curry votes yes.
Representative Dathan.
Representative Dathan votes yes.
Representative DiCaprio. Representative Delaney.
Representative Delaney votes yes.
Representative Delnicki.
Representative Dillon.
Good morning. Representative Dillon votes yes.
Representative Felipe.
Representative Felipe votes yes.
Senator Flexer.
Senator Flexer votes yes.
Representative Fonsello. I'm sorry, Representative Fonsello. Representative Garabay.
Representative Garabay votes yes.
Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Oh, one more time for me, ma'am, please.
Representative Gilchrist votes yes.
Thank you. Senator Gordon. Representative Gonzalez. Representative Haddad.
Representative Haddad votes yes.
Representative Hall. Representative Harrison.
Representative Harrison votes yes.
Representative Hoxa. Representative Johnson.
Representative Johnson votes yes.
Oh, your camera's off again, ma'am.
I'll try and connect again. I was on before.
Okey dokey.
Sorry about that.
That's okay. Representative Khanna.
Representative Khanna votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Senator Kushner votes yes.
Senator Lesser.
Senator Lesser votes yes.
One more time, sir.
Lesser votes yes.
Thank you. Senator Marks.
Marks votes yes.
Representative McCarty.
Representative McCarty votes yes.
Senator McCrory. Representative Nolan.
Representative Nolan in the affirmative.
Representative Porter.
Representative Porter votes in the affirmative.
Representative Osborne. Up. Can't, you need to vote again, ma'am. I did not hear you or see you. Representative.
better? Osborne votes in the affirmative?
Gotcha. Representative Reyes.
Representative Reyes in the affirmative.
Representative Rosario.
Representative Rosario also in the affirmative.
Representative Rutigliano. Representative Ryan. Representative Sanchez. Senator Slapp.
Senator Slav votes yes.
Representative Sims. Senator Summers.
Summers votes yes.
Representative Terciak.
Representative Terciak votes yes.
Senator Winfield.
Senator Winfield in the affirmative.
Representative Zawistowski. Representative Hoxa.
Hi, hear me?
I can hear you, but yeah, so.
Hello?
Hi. Can you hear me?
Hi, can you hear me?
Yes.
Yes.
Can you hear-
Representative Hoxa votes yes.
Thank you, sir. Senator Anwar.
Senator Anwar votes yes.
Are there any other members who have not yet cast their votes who would like to do so?
Yes. Representative Johnson.
Darn. That.
Hello.
Hello, your camera's still not working.
My camera on my cell phone seems to be working, but not on the
Right.
not on. Let me just. I'm on my cell phone now. I'm going to get out of here on the state computer.
Yeah, you let me know when you're ready.
Hello.
Hi there. All
All
right.
right. I don't know what's going on with my computer. Maybe
All
it's the sun or something.
Representative Johnson.
Votes yes.
Thank you, ma'am.
Thank you so much.
Madam Administrator, could you announce the tally, please? Total number voting 40, those voting yea 40, those voting nay 0, those abstaining 0, those absent not voting 13. Thank you. The motion passes. And as Appropriations has more business to do, we will recess from this part of our process and turn it back over to Human Services. We need Human Services, please. Senator Lesser, Representative Gilchrist, we need you to go ahead, ma'am.
Yep, I'm here. Hi, I'll call back to order the Human Services Committee and we will close the meeting, adjourn.
So moved.
Oh, is there a second?
Second
by Cook.
All right, there was a motion by Rep. Hughes and a second by Representative Cook. The Human Services meeting is now adjourned.
Thank you. And then we're going to bring back to order the Appropriations Committee meeting, and we have two bills that have been referred from the floor for review. I'll entertain a motion for substitute for Senate Bill number 1032.
So moved.
An act
So
requiring
moved, Representative Nathan.
disclosures as amended by Senate A. Representative Walker has moved it. Is there a second?
from
Second,
Senator
Representative
Berthel.
Harris.
By Senator Berthel.
Thank you.
There any discussion? Seeing no discussion, Madam Administrator, could you call the vote, please? Senator Austin. Senator Austin votes in the affirmative. Representative Walker. Senator Hartley. Representative Exum.
Representative Exum votes yes.
Representative Paris.
Representative Paris votes yes.
Senator Berthel.
Senator Berthel votes in the affirmative.
Representative Nuccio.
Representative Nuccio votes no.
Senator Anwar.
Senator Anwar votes yes. Senator Anwar votes yes.
Thank you, sir. Representative Baker.
Representative Baker votes yes.
Representative Belinsky. Representative Callahan.
Representative Callahan votes no.
Representative Candelaria.
Candelaria votes yes.
Representative Chaleski.
Representative Teleski votes yes.
Representative Curry.
Representative Curry votes yes.
Representative Dathan.
Representative Dathan votes yes.
Representative DiCaprio. Representative Delaney.
Representative Delaney votes yes.
Representative Delnicki. Representative Dillon. Representative Felipe.
Representative Felipe votes yes.
Senator Flexer.
Senator Flexer votes yes.
Representative Foncello. Representative Garabay. Representative Garabay. Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Gordon. Representative Gonzalez. Representative Haddad. Representative Hall. Representative Harrison.
Representative Harrison votes no.
Representative Hoxa. Representative Johnson.
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Senator Lesser, Senator Marks, Representative McCarty,
Representative McCarty votes yes.
Senator McCrory, Representative Nolan,
Representative Nolan votes in the affirmative.
Representative Porter,
Representative Porter votes in the affirmative.
Representative Osborne,
Representative Osborne votes yes.
Representative Reyes,
Representative Reyes in the affirmative.
Representative Rosario,
Representative Rosario in the affirmative.
Representative Rutigliano, Representative Ryan, Representative Sanchez, Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Representative Sims votes in the affirmative.
Senator Summers,
Summers votes yes.
Representative Tursiak,
Representative Tursiak votes yes. Thank you.
Senator Winfield, Representative Zawistowski, Representative Hoxa,
Representative Hoxa votes yes.
thank you, sir. Anyone else?
Madam Administrator, this is Senator Marks.
Yes, ma'am.
Senator Marks votes yes.
Thank you. Anyone else?
Susan, this is Representative Ryan. I vote yes.
Thank you, sir. Anyone else? All set? All right.
Madam Chair. Madam Chair,
Yes, Senator Berthel.
may I make a request that we can hold votes open for a short period of time today on these two items before us?
I think about about a half an hour, sir?
Yes, ma'am. I think that would work. Thank you.
Okay. Up next is item number 4, substitute for House Bill number 6760, an act concerning civics, education, media literacy. I'll entertain motion moved by Representative Walker, seconded by
Second.
Second,
Harris.
Representative Dathan.
Madam Administrator, is there any discussion? Representative Chaleski.
Thank you, Madam Chair. I just want to make a brief comment that the State Department of Education Commissioner testified on this bill in Education Committee, stating that this work has already been done within the State Department of Ed. So I feel this is duplicative and time and resources away from that department, and as well as civics and media literacy already being taught in many of our schools and required. It's required of Danbury School. I know that for a fact. And for those that are not, it's another mandate upon our schools. And while I'm not against teaching the civics piece, I do not have a clear understanding of what the media literacy piece is exactly. So I will be voting against this. Thank you, Madam Chair.
Thank you. And we've been asked to return this piece of legislation for more work back to the floor of the House, and I'd ask my colleagues to support it currently as is. Is there any further comment? Seeing no further comment, Madam Administrator.
Madam Chair, I'm sorry.
Yep,
may I-
Representative McCarty.
Yes, thank you. And I appreciate the representative's comments, but I do want to say that there is more work being done on this particular proposal. And there were questions about the makeup of the task force, and that is being looked at. And so I will be supporting it today to move it out of appropriations. Thank you.
Thank you. Any other comments or questions? Seeing none, Madam Administrator, if you could call the roll, please.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Representative Paris votes yes.
Senator Berthel,
Senator Berthel votes no.
Representative Nuccio,
Representative Nuccio votes no.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan,
Representative Callahan votes no.
Representative Candelaria,
Candelaria votes yes.
Representative Chaleski,
Representative Chaleski votes no.
Representative Curry,
Representative Curry votes yes and looks forward to sharing the updated draft and membership with everyone.
Representative Dathan,
Representative Dathan votes yes.
Representative DiCaprio, Representative Delaney,
Representative Delaney votes yes.
Representative Delnicki, Representative Dillon, Representative Felipe,
Representative Felipe votes yes.
Representative Dillon,
Madam, I voted yes.
thank you.
Oh, wait a minute. Do you need the camera? Yes.
I got you.
Okay.
Senator Flexer,
Senator Flexer votes yes.
I'm sorry, we had some crossover in audio. If you could one more time, Senator Flexer.
Senator Flexer votes yes.
Thank you. Representative Fonsello, Representative Garabay,
Representative Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Representative Gonzalez, Representative Haddad, Representative Hall, Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
No.
one more time for me, sir.
Sorry, Representative Hoxa votes no.
Thank you. Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes yes today.
Senator Kushner, Senator Lesser,
Senator Lesser votes yes.
Senator Marks, Representative McCarty,
Representative McCarty votes yes.
Senator McCrory, Representative Nolan,
Representative Nolan in the affirmative.
Representative Porter,
Representative Porter votes in the affirmative for equity.
Representative Osborne,
Representative Osborne votes yes.
Representative Reyes,
Representative Reyes in the affirmative.
Representative Rosario,
Representative Rosario also in the affirmative.
Representative Rutigliano, Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Representative Sims in the affirmative.
Senator Summers,
Summers votes yes.
Representative Terciak,
Representative Terciak votes yes.
Senator Winfield, Representative Zawistowski, anyone else who would like to vote?
Madam Administrator, Representative Hoxa has his hand up. Does he need to vote again?
Would you? Are you?
Yep.
Yes. sir.
Hi, yeah, hi, Susan. Can I change my vote on the previous bill, 1032, from a yes to a no, please?
You certainly may, sir.
Thank you.
I'm sorry, Madam Administrator. Did he?
I think we're all set on 67, 6. Oh, Senator Summers.
Yes, Madam Administrator, for some reason I voted incorrectly. I meant to vote no. Can I please correct my vote?
Certainly on this on item on House Bill 6760, ma'am.
The last one on the civics.
Yep, got it.
Thank you.
You're welcome.
Is there any other? Madam Administrator, are you all set on those two
I
votes?
believe I am, Madam Chair.
Okay, is there any other business or resolutions legally before the committee after the preparation of this agenda? All right, that sounds good. We're going to leave the votes open for half an hour from this moment, and we will adjourn at that time. We'll remain in recess until a half an hour. Is that all set with you, Madam Administrator?
Could we do 12:30? So it's a even.
12:30 is good.
12:30.
Yes, thank you. Thank you. So we're in recess until 12:30. Thank you.
Representative Khanna, I see your hand up.
Yes, I just wanted to confirm that you got both of my votes.
Let's double check. Yes, ma'am, you're all set.
Great. Thank you so much. Have a nice weekend.
You too.
Hello, Rep. Sims here. I'm also just checking to see if I missed any votes.
Your named Senator or Representative Gibson, but you look like Representative Sims. So let me change that.
That is correct.
And Representative Sims, you are all set.
Thank you so much. Have a great weekend.
You too. Take care.
You too.
Representative Delaney, you are all set.
Thank you, Madam Administrator.
No problem. Representative Kennedy, you are also all set.
Oh, actually, Taylor, if I could change my vote number 3 under number 4, SB 1032 from a no to a yes, please.
From no to yes. Okay, you're all set, ma'am.
Thanks, Taylor. Have a great day and a wonderful weekend.
You too. Take care. Kathy.
Madam Administrator, it's Senator Marks.
Hi, Senator.
Oh, hey, I lost connectivity. Is it too late?
No, you have 30 minutes, so I need you on, just on 6760, an act concerning civics, education, and media literacy.
Yep, Senator Marks votes yes.
You're all set, ma'am.
Appreciate it.
Have a good weekend. Hi, Representative Dillon.
Hi, I'm looking for I'm having a problem with the camera today.
I can see it's trying to come
Let
on.
me try it on it. Wait a minute. Yeah, well, I may use there I am.
There you are.
Okay.
So,
Yes.
Senate Bill 1032, an act requiring financial disclosures, certain financial disclosures.
I think I seconded that, didn't I? No, I did the waiver. Okay, yes.
Thank you.
That's amended by the Senate, right?
Yes, it is.
Yeah, got it. Thank you.
Thank you.
We're good. Have a great weekend, Kelly. Thank you.
Too. Hi, Representative.
Hi there, how are you?
Good, how are you doing?
Good.
So only two bills for you today. The first being Senate Bill 1032, an act requiring certain financial disclosures as amended by Senate A.
Rep Sanchez, yes.
Okay. And the second is House Bill 6760, an act concerning civics education and media literacy.
Rep Sanchez, yes.
Awesome. You're
set?
all, sir.
All right, have a good weekend.
You too. Take care.
Take care.
Hi, Representative. I think I saw Representative Gonzalez, but I see your name as Rep Porter, so I'm gonna fix that.
Hello?
I can hear you. Can you hear me?
Yes, can hear you.
All right. If you put your camera on, I'll take your vote on, let's see, 1032.
I'm trying here.
Take your time. Oh,
I don't know why I can't, but
giving you a hard time.
having a hard time. I'm trying.
Let me see if I can ping you. I press ask to start video. It might prompt you. There we go. Now I can't hear you, but I can see you. I can't hear you. 32. Yeah. There we go. You were unmuted and then you got muted again. Hold on.
What
There we
about
go.
now?
Stay right there.
Okay.
Okay. So I will take both you and Rep Paul's vote at the same time. So the first one is Senate Bill 1032, an act requiring certain financial disclosures. Rep Gonzalez, how would you like to vote?
Can you repeat that again?
Yep. Senate Bill 1032, an act requiring certain financial disclosures.
Okay. I guess I'm a yes.
Okay. Representative Hall.
Yes.
Okay. And then the second vote is 6760, an act concerning civics education and media literacy. Representative Gonzalez
Yes.
and Representative Hall.
Yes.
Wonderful. You're both all set.
When can I ask you a question? When you said about certain disclosure, what is that? What did that mean? What did that include?
I think that would be a question directed to one of the chairs of the committee.
Okay.
That. I'm happy to text you the bill number if you want to take a look at it.
Okay, no problem. Yes. Okay. I already voted. So, okay. Thank you. Okay.
Have a good weekend.
Guys, take care.
Okay. Bye-bye.
Because don't
Hi, Representative.
Yeah. Yeah, this is my cell phone.
Hi, you can hear me, right? Yep. Okay. I just need you on one vote. Senate Bill 1032, an act requiring certain financial disclosures.
You know, I hate.
Garabay votes yes.
Great.
Sorry about that. One more time.
They have more accidents.
Garabay votes yes. Wonderful. You're all set then. No, thank you, and sorry about that. Don't worry. Appreciate it. Have a good weekend. Bye-bye. Bye-bye. Hi, Representative.
Hi, I just got to, I just had a school group finish up. Yeah, so I wonder, what's that?
You made it in time.
Yeah, just about. They just left. Anyway, did you vote on those last two items? 'Cause I know they're closed on the other things.
Right. So the last two items, the first one is Senate Bill 1032, an act requiring certain financing disclosures.
Yeah, and that's a no.
Okay. And the other one House Bill 6760, an act concerning civics education and media literacy.
Okay, and that's also a no.
Wonderful. You're all set.
Great, thank you.
Thank you. Take care.
Bye-bye. Trying to get off.
Take your time.
Yeah.
Hi, Senator Winfield.
Hello.
Thanks for hopping on.
Yep.
I have, so the first one is Senate Bill 1032, an act requiring certain financing disclosures.
You can just read the numbers. You don't have to read the whole thing.
Okay, okay. And House Bill 6760.
Yes.
You're all set?
Thank you.
Thank you. Have a good weekend. Yes. Hi, Senator.
Aye.
All right, I need you on 1032, an act requiring certain financing disclosures.
Yes.
You're all set.
Thank you.
Thank you.